Coming to the ovarian pregnancy now. Ovarian pregnancy, the criteria given is Spielberg criteria. Studiford was for abdominal, Spielberg is for ovarian, remember that, okay. Now, what is the criteria? The tube on the affected side should be intact. So, the affected side, if it is a tubal, if it is an ovarian ectopic, this is the ectopic developing here. The tube should be absolutely normal. It should not show any evidence of rupture or any evidence that it has perforated anything, okay. So, it should be absolutely intact. Gestational sac on sonography should be in this position, in the position of the ovary. It should be connected to the uterus with the help of the ovarian ligament and the ovarian tissue. When you send it for HP, for histopathology, the pathologist will tell you that the sac, the gestational sac had chorionic villi. Along with that, there was ovarian tissue found on histopathology. So that is the typical criteria for Spielberg. Very, very simple. Very, if you think why this criteria has been given, if you think about the factors, you can write them on your own. It is very, very simple criteria, okay. Embedding of the gestational sac in the ovary can be of two types. It can be intrafollicular, it can go inside the follicle, or it can be extrafollicular. That means it has gone into the cortex, but it has not entered the follicle, okay, because the ovary, you know, has cortex outside and medulla inside. So this is the cortex which has all the follicles. The different types of follicles are there, different primary, secondary follicles are there. So this can go inside anywhere. The ectopic can grow. The ectopic can grow either inside the follicle or it can be outside, intra or extra follicle. Now, rupture is inevitable in ovarian pregnancy. Inevitable means you cannot prevent it. It is inevitable. It has to happen. Like the tube, instead of rupturing, it might undergo abortion, it might undergo perforation, but the ovary, it has no other way. It might take slightly longer to rupture because it has more space as compared to tube, but it will rupture. So the rupture is inevitable and you have to do a surgery, or if it is unruptured, you can go for a medical management.